Hey y'alls, my dog's here. Say hi, Thor. Say hi, Mabry. Hi. He's already bored. Okay, I am late to the party, to my own party. So hopefully I have better cell reception than I did last time for my live video. And I'm just going to answer a couple of questions. You guys are welcome to ask some questions. Hopefully I'll see them in the comments. I do want to make this brief since I tend to ramble on. This is cycling. Problems with cycling, pain with cycling. My name is Dara for the people who maybe don't know me. I'm a physical therapist and I work mostly with cyclists and runners. And so if you have a cycling related question, you can ask. If I cannot answer it today, right now, then we can talk about it in some other place, DMs or whatever. Hit me up with all your questions. So the main topic for today is one-sided pain, knee, hip, back, cycling, running. I get this all the time because that's kind of my jam, as I mostly work with cyclists and runners these days. I am a cyclist and runner myself. I've probably had every injury known to man and crashed on every bike that I've ever owned. So I'm familiar with all these injuries myself, having treated them and dealt with them. Super common. Again, I did a post yesterday, it was yesterday, talking about this same topic. So if you want to scroll back and check that out. And really it's just describing the fact that this is really common for our sport. And the reason why it's so common for cyclists and runners, hey guys, hey, hi people. Neighbor dog barking. So the reason why this is super common for us as cyclists and runners is because our sports are super repetitive. We do the same thing over and over and over, pedaling, over and over and over, one-dimensional, running, right, like this. So most of what I see, and I do see a lot of knee pain, hip pain, back pain with my runners and my cyclists, it's not because there's something really wrong with you, right? None of us are built symmetrically, first of all. So anyone who's like, oh, I have a leg length discrepancy or blah, 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 my chiro said my leg, like, that's everybody. That's me. That's you. None of us are perfectly symmetrical. We are humans. We are not robots. So we are not built to be perfectly symmetrical. However, you are putting an asymmetrical human onto a symmetrical, repetitive AF sport, right? Oh, Thor's here. He's asleep already. He's like, my dog's like, oh, we're not running? Oh, okay, bye. Sleeping. So yeah, we are in a sport that requires a lot of symmetry, and we are not symmetrical beings. So that doesn't mean we quit our sports, but it means to diversify, right? It means that we need to do some maintenance work when we are off of the bike and outside of running. For a lot of you guys, you're already doing that, right? You're doing some yoga, some strengthening work, some strength training. And that's kind of what it boils down to, is having a little bit of diversity in your movement patterns and not being stuck in this repetitive AF sport, and having the breadth and the width of other things outside of just your sport. Now, if you're a cyclist and all you do is flex over a bike all day, and then you go back to your desk and you flex over your desk, and then you're on your phone and you're hunched, your spine is not going to like that, right? You're going to develop some limited mobility. So part of it is, can I teach people to do things that are outside of the sport to work on you, right? To create more of that mobility, more of that strength. And again, the point is not to be perfectly symmetrical, because that's never my goal in physical therapy, is to make somebody perfectly symmetrical. My point is to make you more symmetrical, right? If you're having pain points, if you're having enough pain that you're coming to see me, it tells me that something is off in the chain. And that could be the top, it could be the middle, it could be the bottom, right? This is all connected. So I need you guys to kind of like open the lens when you start to look at your own body, right? You don't need to go like PT yourself. That's my goal, is always to teach, educate, so that you can start to take a step back and say, okay, well, why is my left knee always hurting? Is it because my left hip is my tighter hip? Is it because I had an injury back in the day, I crashed on that side, yada, yada, yada? A lot of times, if you kind of unpack and take the time, which is what I do when I see patients, there's something that was going on with that left hip. There's something that was going on with that left foot, and now your knee is just taking the brunt of it, right? So if we're talking about knee pain specifically, a lot of times you got to open the lens, just take a step back and look at the bigger picture. If you were like, oh, I had this crash and then I landed on my left hip and then like I couldn't walk for a while and I feel like my left hip is weaker, guess what? That's probably part of the issue, right? Work on it. So my job is not to make you perfect, but if you're sitting on the saddle, guess what? The saddle is perfectly level. If you're like this, your bike fitter can't fix that. That's a you thing. That's not a bike fitter thing, right? Now, I work with bike fitters all the time. Do you need to get a bike fit? Absolutely, right? If you're riding your bike more than once a week, in my opinion, get a proper bike fit. Pay the money, right? Your ass is on that thing for hours and hours and hours. Get it fit, get it dialed. However, your bike fitter is not a fucking magician. right? They cannot fix problems. That's a you thing, right? My goal in physical therapy is really, when I work with clients, I don't BS. I tell people straight up, like, dude, you got to do the work, right? Your bike fitter is not a freaking magician. I'm not a freaking magician. Just take the time, work on the maintenance. Just like you have a nice car, are you going to do maintenance on it? Or are you just going to drive it into the ground and hope it works? I'm like, oh, the freaking chassis and the alignment's off, blah, blah, blah. No, do the work. So the work itself isn't hard. And I will talk about some things, just some ideas for you guys to think about. But really, takeaways. 1, none of us are symmetrical. The goal is not to be symmetrical. The goal is to be more symmetrical, right? A little bit more level if you're having pain points. Even if you're not having pain points, do some stuff outside of just biking and running, right? Get some stretching in, get some yoga in, get some strength training in. Any of my plans have this stuff for you. That's why I made them. I make them simple, direct, to the point. Go buy the freaking plan. Do that. Watch my YouTube, whatever. Get dialed. Get that stuff figured out. Number 2, your bike fitter's not a fucking magician. Do some work on your own body, right? If they can't fix if you have one hip that's super weak, that's a butt weakness thing. That's not a fixing the saddle thing, right? Or, well, I'm going to keep tilting the fore aft of the saddle. The other thing I'll say with the bike fit stuff is my goal in PT is that, in theory, you should be able to ride any bike with the crappiest bike fit ever and still not have problems. If you're fiddling constantly with my saddle, I've gone through 12 saddles and I've gone through my shim and then I've raised that's a you thing. That's a you thing. That doesn't mean there's something wrong with you. It means that you need to start addressing things with you. It's not going to be the shim and the cleat and the adjustment and the float and the rotation. And there's value in all of those things, but to a point, right? So if you are searching for your 50th saddle and your 50th shoe and your 50th insole, stretch your calves, do some ankle mobility. Let's work on some hip mobility. Let's work on some glute medius strength, some hip stability strength. That's a you thing. And what your body is telling you is that you are trying to force a square peg into a round hole, right? The saddle is perfectly symmetrical. This is a very repetitive sport. Something is off with you ever so slightly. Work on it. And it doesn't need to be perfect. It just needs to be better, right? And for most people, all that is a couple days a week of a little bit of stretching, a little bit of strength stuff. Now, you can go down the rabbit hole and get all crazy kung fu ninja boot camp hit classes, but it doesn't have to be. The reality is that if you can implement some mobility work and some strength work, and I will talk about some specific stuff coming up next that addresses some of those deficits or those asymmetries in your body, right? Because your body's different than my body. Your body will be more symmetrical and you will feel better, whether it's running. Every time you strike the ground on that one hip, well, that's my weak butt. So now my hip drops. So now my knee dives in. So now my knee hurts. Strengthen that butt, right? Or my knee's diving in when I'm on the bike. It's always that one knee. It's always that one knee. And then I always get like a saddle sore on the inside of that left side. And it's my left knee. That's probably coming from that left hip and that left pelvis, and that left part of your lower back is tighter and or weaker, right? So start to unpack these things and think about it. Now, you can come to me and I'll break it all down for you and make it as simple as possible. But if you can't, and or you don't have the funds or the time or whatever, start to think about like what is really driving the source of your problems. And if all you're focused on is the knee, that shit's never going to get better. You need to take the lens, open up the lens, look at your whole body. What can I work on at my hips? Generally, if I break it down, it's most simple. My hips, my back, my feet, right? Is something stiff? Is it tight? Is it weaker on one side? Is that old injury part of the thing? It probably is. If your gut is telling you that, that maybe, I did that thing and then like I was like in a cast for like a month. Yeah, that's probably why. That's probably like your tighter side. Or if you're like, every time I go to yoga class, here's one thing I'll tell patients. Like, you ever go to yoga class and you're doing like that hip opener, pigeon pose, and you're like, oh yeah, my left side is always my tighter side. For me, it's my left. I know that because I've had left knee pain, left lower back pain. Sometimes it was left low back, and then it would gravitate to my right when I would really piss it off. I go to yoga class and my pigeon pose is always tighter on my left hip. Guess what? That's your tighter side. Guess what? It's never going to change. That's your side. Somebody else is their right side. Work on that shit. So what it means is when you go to yoga class or Pilates or physical therapy, if they just gave you some generic ass handout, which is my pet peeve, is when PTs are like, oh, here you go, here's something that I gave 500 other people because I didn't even like listen to you. And it's this knee rehab thing, and it says, you do your knee to chest stretch, and you do your knee to chest, and they didn't write down left versus right. Guess what? Let me tell you, since you're not my patient, maybe you are, maybe some of my patients are here right now. If they didn't tell you that, listen to your body. If that left hip is tighter, work on it more. If you want me to give you a number, I'll give you a number right now. If you're holding the left side, the right side for 60 seconds, hold the left side for 90 seconds. Hold it a little bit longer. You are trying to create a little bit more relative symmetry in a very asymmetrical human so that you can do a very repetitive sport that requires a decent amount of symmetry. That is the crux of the issue for most of the athletes that I see in physical therapy, when I'm working with strength and conditioning, when I'm working with Olympians, elite athletes. It's all the same shit, you guys. You're not special. I'm not special. They're not special. And that should decrease some of the stress that people feel when they're like, oh my God, my knee. Oh my God, it's not going to get better. It's going to get better. Work on it, because if you don't work on it and take the lens out and look at the bigger things that need to be addressed, which is maybe long-term just getting more glute strength on that side, or core strength, or ankle mobility, whatever, this stuff just comes back. It just comes back. I go to bike fit, oh, it's good for a while, and then it comes back. Do the bike fit, do all that other stuff, but really look at what's going on with you in that symmetry and how you can create more symmetry. Now, if we get into exercises really quickly, because I want to get into it, I have a patient right now who's in Europe, knee pain, Well, she's got some stuff going on in whatever knee it is, and then we also had some stuff going on at the ankle and the foot and the big toe on that side. So we need to work on glute strength for the win, right? Right? Yep, he knows what's up. So a lot of times we'll find, okay, well, if I can work on improving the ankle mobility, and that means how much that foot needs to flex, and this is relevant to running and cycling. If your foot and your ankle is super stiff, and you like when you go into a squat, you're on your tippy toes all the time, or your feet turn out all the time, that is probably happening when you're on the bike. And if your foot and ankle does not move very well, guess where it's gonna go? Boom, up the chain to your knee. If your hip and your ass is weak and your glute is weak on that side, and you're sitting on the saddle like this and you don't have a strong booty, and you're dipping that hip down, say it's my right side dropped, my knee's gonna dive in. And I'll show you right now what I mean. Hopefully you guys can see me. So if I have, no one has symmetrical hips, right? So say my right hip, my right glute is weaker, ever so slightly, I'm dipping. I don't know if you'll be able to see this because I have my crazy camo pants on. So I'm here, I'm sitting on the saddle, right? I should be level. I'm running, ground strike, heel contact, pelvis should be level. Same thing, different sport. I'm like this, I'm landing or I'm pedaling and I'm not being supported here, and it could be glute max. A lot of times it's glute medius, side of the hip, holding that hip up stable. If that hip is dropped, that knee is diving in. Now, that's okay if you're pedaling for 5 minutes, but if you do that 1,000 fucking times on a bike every day, or even 100 repetitions, you're driving stress into the inside of that knee, right here. Sometimes it's outside of the knee. All that matters is the angle is off. So strengthening here pulls me back up. Now, is it as simple as that? It's obviously not as simple as that, but that's just one thing that you want to think about is, am I being stable at the hip? And if not, is that driving that knee in or out, right? Or do I just have a really stiff hip that is so lacking in mobility that I literally cannot get my knee up here, so my knee's going out to the side? Like those old dudes with their knees out to the side. You know why they're doing that? Their hips are so tight. Old man, tight hips, knees going way out to freaking no man's land. A, that's not great for their hips. It's not good for your back. It's not good for your knees. So these things are all related, right? So I cannot give everyone like this generic handout of like, hey, here you go. Everyone needs to do more left glute medius strengthening. But what I want you to understand is that there's a lot of little things that if you just take some of this stuff out and you start exploring that with yourself, you're like, hey, when I do my pigeon pose, my left butt is like always tighter. Work on it more, especially if that's the knee that's always bugging you, right? Foam roll that side more, right? We're not trying to do exercises exactly the same. We're trying to create more symmetry in the stuff we do off the bike so that we can be more symmetrical when we get onto the bike. And for all of my endurance athletes, whether you're All these things that I had, they happened when I was training for Leadville, so that's a 100-mile mountain bike race, and it's because the volume increased. More time, more repetition, more time for those little teeny nuanced things that were kind of off in my body to just become magnified, because I was training harder, longer, my rides were longer, I was riding for 5 hours, 6 hours, etc. And all of a sudden something that wasn't really an issue, like my left hip is always kind of tighter, well, now it became an issue. My low back started to hurt, my knee started to hurt, right? Last thing I'll say about foot and ankle is if that foot and ankle is limited, that is also going to go up the chain. So we've got two things going on. They also bounce off of each other. If you're always that tight ankle, stiff calf person who's not flexible, that is going to go up the chain over time. You have that hip that's dropped. Now your glute is weak. So it's one thing can cause the other thing. Then that thing goes back to the original thing. So at the very least, I want you guys to take a little, kind of take a step back. And when you're doing some of your, whether it's strength training stuff that I've given you in any of my plans, or whether it's yoga class that you go to, or whether it's something that your old PT or trainer, whatever gave you, when you start to notice those things, like I come into a squat and one foot goes this way and one foot goes that way, look at that. I tell people, hey, when I have them in my clinic, I'm like, yo, do you see what your foot's doing? I'll video them and I'll show it back to them. They're like, oh shit, I didn't even see that. I'm like, yeah, guess what? Think about that. That is what you do in the gym. The reason, not only is you're going to get stronger, but it is a chance for you to work these things out, clean them up. When I have somebody do a squat, I'm like, dude, I cannot have one foot this way and one foot this way, right? If both feet are like that, sure, that's you. You're tight. That's how you're going to live. If one foot's here and one foot's like out to fucking no man's land, like, dude, we got to fix this. We've got to get this a little bit more aligned. Your bike fitter cannot just have your cleat rotated to do that for the rest of your life. Like, work on it. Again, are you going to be perfectly this way? No. Can I get you a little bit more that way so that you don't have pain, right? All of these things, it's not about being perfect. So that's the takeaway. You are not symmetrical. I am not symmetrical. There's nothing wrong with you grossly, right? You are just trying to do a very symmetrical, repetitive sport, and the little nuances of things that are off about your body, which are human, are being magnified because it's a very repetitive sport. So get the bike fit. Do some strength training. Do some mobility work. Mobility means stretch, foam roll, whatever. Focus on where you notice things that are different. Is the left versus the right? Pay attention to your form. I cannot tell you the amount of times that I have to correct people on a basic squat and a deadlift. And why do I give that so often to people? Because those are functional movement patterns that you need in life. Get your ass onto the toilet, get out of your car. But also, if you want to sit on a bike, pedal, descend, technical terrain, you better know how to squat and deadlift, because that's positions that you need on the bike. Learn how to do it. Practice it in the gym. Look at those things. Look at your foot position. Is my arch super collapsed and going off this way? Well, that's going to drive stress into your knee. And it's also going to weaken that glute over time. So that's all I got to say for today. If you guys have more comments and you want to ask me more specific stuff, like obviously I can't like diagnose and treat you like via Instagram in 5 minutes, but I want you to just take these little takeaways that like you may need to do a little bit more glute strengthening into that left hip, right? All my mini band videos, when I'm talking about glutes, that's what I'm talking about. Start with that, right? Start there. All my ankle mobility and foot and ankle stuff. I have a lot of calf stretching, ankle mobility, downward dog. That's another one you can add in just to get those ankles moving better. Hip and back, it's all the same stuff. Left hip, knee, back, da, 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 da. I don't care if it's your left lower back, your left hip, your left knee, your left foot, whatever. Look at the whole chain. And chances are there's something on that side or on the other side that's off, that's driving stress here, here, or here. Don't hyper focus on the symptom. Open up the lens and look at the source of the problem. And for many of you guys, it's now multiple things, right? That's weaker, that's tighter. Take a step back, look at it, because the hip is related to the back. You guys have heard this before. This isn't fucking rocket science, right? The hip is related to, but it is, right? So really think about things in like the bigger picture, because I guarantee you, unfortunately, a lot of the doctors that you see are not, and they're just looking at your knee. And you need to be your own advocate for your own health sometimes, and take a step and go, hey dude, I think it's like my back and like my tightness on that left side of my back. Yeah, it's that. If that's what you think it is, you're probably right. So go with that. That's it for today. I gotta run. I gotta go back to work. I gotta see a patient. But if you have questions, let me know. If this was helpful, let me know. If you have any other things you want me to cover next time in a chat or an IG live, I will do it. I will try to be on time. Thank you so much for coming. Hopefully the reception was good and you could hear everything that I said. I will see you all next time. Sorry I didn't get it to wave everybody. Oops. Sorry guys. Bye. I'll see you later.